In this podcast episode, Brigham Buhler shares his extensive experience and insider knowledge from multiple facets of the healthcare industry, exposing systemic corruption, inefficiencies, and the intricate web woven by pharmaceutical companies, insurance corporations, and regulatory bodies. He discusses the broken U.S. healthcare system, the impacts of insurance models on patient care, the truth about medications like antidepressants and opioids, challenges with compounding pharmacies, and cutting-edge advances in hormone therapy, peptides, and stem cell medicine. The conversation also explores the roles of lobbying in politics, the battle for patient autonomy, and glimpses into the future of personalized medicine and biotechnology. Brigham Buhler began his career as a drug representative, launching a new erectile dysfunction medication, expecting to help patients through education and innovative treatments. However, he quickly became disillusioned by the reality of pharmaceutical marketing, which focused more on sales, quotas, and pushing medications for profit rather than genuine patient care. Transitioning to medical devices, he gained insight into hospital systems, surgical procedures, and the interplay between insurers and providers. The personal tragedy of losing his brother to the opioid crisis motivated him to start a pharmacy aimed at providing non-addictive alternatives to opioids. Over time, he realized that working within the insured healthcare model stifled innovation and patient-centered care, leading him to establish one of the first cash-pay pharmacies to circumvent the restrictive insurance framework. Buhler reveals how the modern U.S. healthcare system commodifies chronic illness, managing symptoms rather than preventing disease. Insurance companies control much of what physicians can do diagnostically and therapeutically, limiting time with patients to typically 6 minutes per visit and restricting access to comprehensive tests. Physicians, burdened by this system, often resort to prescribing pharmaceuticals as quick fixes, fueling a cycle of increasing medication usage. This results in America being the most chronically ill-developed country with some of the lowest average health spans, despite high healthcare spending. The insurance model prioritizes quarterly profits over long-term health, often denying more detailed blood work or advanced diagnostics that could prevent disease progression, all to reduce immediate costs, even though these decisions burden employers and taxpayers later. Buhler exposes the layers of influence shaping prescribing habits, including pharmaceutical companies, sales reps, and pharmacy benefit managers, PBMs. Although direct kickbacks have been curtailed legally, subtle systems remain where prescribers are encouraged to increase sales of high-profit drugs. He recounts witnessing training sessions where psychological drugs were pushed aggressively despite modest efficacy over placebo. The industry's influence extends to clinicians' continuing education and prescribing tools, often designed to favor profitable drugs rather than optimal patient outcomes. Insurance and PBMs also leverage rebate schemes that inflate drug prices artificially, creating a complex shell game where the actual costs and profits are obscured from patients and providers alike. Pharmacy benefit managers, initially created to negotiate lower drug costs, have since been acquired by major insurance companies, transforming them into profit centers rather than cost savers. PBMs negotiate secret rebates with pharmaceutical manufacturers that inflate the official drug prices billed to insurers and patients, while pocketing a large portion of these rebates. This complex web incentivizes the continued use of expensive, brand-name medications over cheaper or compounded alternatives. Buhler underlines how these practices hurt patients and employers alike, increasing healthcare costs while limiting true therapeutic options. To combat the restrictive insurance environment, Buhler turned to a cash-pay pharmacy and medical model, offering direct-to-consumer options for diagnostics and therapeutics outside insurance constraints. This enables comprehensive blood testing, DEXA scans, VO2 max assessments, advanced hormone profiling, and more, allowing for precision, proactive, and preventive care that traditional insurance models do not support. This approach empowers patients with data and diagnostic clarity so they can work with clinicians to target root causes rather than patch symptoms with prescriptions. An eye-opening segment focuses on antidepressants, specifically SSRIs and their serotonin hypothesis. Buhler shares his firsthand experience learning that the biochemical basis for these drugs remains unproven by scientific studies. Despite widespread use, depression rates and suicide rates have only escalated, highlighting the disconnection between pharmaceutical theory and real-world outcomes. He points out that lifestyle factors such as exercise and sleep often outperform these medications. The entrenched pharmaceutical influence in medical education and prescribing reinforces this flawed approach, promoting drug therapy rather than holistic patient care. Buhler explains how insurance companies dictate diagnostic and treatment decisions, often denying comprehensive blood work or advanced testing. Physicians are contractually pressured to limit tests and focus on compliant prescriptions, which frequently means symptom management over prevention. The insurance carriers also shift the cost burden onto employers and patients through explanations of benefit statements, complicated billing schemes, and denials, creating confusion and frustration. This environment encourages overprescribing, particularly of drugs with high rebates and profit margins. Buhler defends compounding pharmacies, which produce personalized medications not covered or approved by insurance or major pharmaceutical companies. These compounded drugs often offer non-addictive and novel alternatives and can be more affordable when bypassing insurance. Despite rigorous sterility, validation, and safety protocols, compounded medications are under constant attack by large drug corporations who use lawsuits and lobbying to suppress competition. The FDA's lack of response to multiple Freedom of Information (FOIA) requests about peptide safety data and the banning of many peptides without evidence highlights systemic obstructionism. A large portion of the discussion centers on the deep influence of pharmaceutical companies over the FDA and other regulatory bodies. The revolving door between FDA commissioners and industry executives fosters conflicts of interest that obstruct patient-centric innovations. The FDA's approval processes often rely on daisy-chained approvals without robust human safety data. Lobbying expenditures by big pharma and insurers reach into the tens of millions, ensuring that regulatory decisions favor profits, even when that may harm patients or block access to better therapies. Buhler recounts his own experiences with social media censorship, financial blockades, and legal threats aimed at curbing his company's growth because they offer non-insurance, patient-centered treatments. Hormone therapies such as testosterone and estrogen optimization are discredited myths in many medical circles, often rooted in outdated or minimal research from decades ago. Buhler explains how modern studies contradict these old fears and show benefits for metabolic health, bone density, cognitive function, and quality of life without increasing cancer risks. The insurance system complicates access to hormone treatments, requiring long referral processes, prior authorizations, and denials. Clinicians bound by insurance contracts frequently lack the tools to perform comprehensive diagnostics or prescribe such therapies properly. Buhler emphasizes the need for a drastic paradigm shift toward proactive, predictive, and preventive healthcare. This means using comprehensive metabolic diagnostics, body composition analyses, genetic screening, and lifestyle optimization to avoid chronic disease, rather than waiting to treat symptoms with pharmaceuticals. He advocates for patient sovereignty and the right to work with clinicians outside of insurance constraints to craft personalized treatment plans. Technologies like AI-driven algorithms and large language models present new opportunities for democratizing health knowledge and putting power back in patients' hands. The conversation delves into the financial and institutional incentives driving the strict adherence to pediatric vaccine schedules. Large, vertically integrated hospital systems purchase vaccines in bulk and directly influence pediatric practices through compliance-based bonuses, aligning clinical decisions with revenue generation. Physicians born into this system may be unaware of its financial dimensions and believe strongly in the mandates, sometimes resulting in pressure or even refusing care to vaccine-hesitant families. Some states, including Texas, are pushing legislation to prevent children's exclusion from care for vaccine noncompliance to counteract this coercive environment. Buhler, collaborating with advocates like Callie Means and Bobby Kennedy Jr., exposes the role of ultra-processed foods, sugar-laden beverages, and pesticide exposure in fueling chronic diseases such as diabetes and obesity. He shares alarming data on glyphosate contamination in common breads and massive sugar contents in soft drinks. The convoluted influence of food industry lobbying mimics pharmaceutical capture, embedding unhealthy dietary guidelines into school, military, and welfare food programs. Recent shifts in government dietary recommendations and reforms in school food programs represent hopeful progress. Unexpectedly drawn into the political arena, Buhler now regularly collaborates with influential figures like Bobby Kennedy Jr., Callie and Casey Means, and Marty McCary, providing testimony and insider expertise to advance public health reforms. Together, they challenge entrenched interests in Congress and at the FDA, aiming to establish pathways for affordable and accessible peptide therapies, hormone optimizations, and preventive healthcare. Despite significant pushback from industry-aligned officials, this coalition fights to open regulatory frameworks that enable patient choice and to dismantle monopolistic controls. FDA restrictions and pharmaceutical lawsuits have severely limited access to many peptides once used widely and safely. Companies like Eli Lilly have sued compounding pharmacies, producing cheaper compounded versions of popular drugs like GLP-1 analogs, even when the FDA has encouraged compounding to meet demand shortages. Courts have yet to find evidence supporting the industry's safety concerns. Meanwhile, unregulated gray and black market sources fill the void, posing risks of contamination and dosing errors. Buhler's own rigorous testing confirms high variability and contamination in many black market products, underscoring the danger of restrictive policies that push patients toward uncertified sources. Buhler shares eye-opening insights from his recent research collaboration with Japanese scientists on Muse stem cells, a highly resilient, potent subset of stem cells with promising regenerative properties. Unlike conventional stem cells that may lose viability quickly, Muse cells survive longer, potentially remain in the body for years, and avoid tumor risks. Early studies show benefits in organ transplantation, neurodegenerative diseases like Alzheimer's, and orthopedic injuries. Buhler provides real-world examples of patients regaining mobility or cognitive clarity after advanced stem cell treatments. He advocates federal regulatory reform to enable broader access to these therapies across the U.S., highlighting right-to-try legislation in some states. The podcast finishes looking ahead to rapid developments in genetic engineering, epigenetics, and biohacking. Emerging technologies can activate genes to significantly increase bone density, muscle mass, and cognitive function. These advances could mark a new era of human optimization, crossing the boundaries of traditional medicine. While some projects are currently operating offshore or in military-funded programs, their implications for longevity and health span are profound. Buhler notes the ethical and regulatory challenges posed by these innovations and stresses the importance of individual autonomy and responsible oversight. The role of psychedelics in mental health treatment, cognitive enhancement, and trauma recovery receives a multifaceted discussion. Buhler touches on current clinical trials, their commercialization, and complex funding dynamics with rival billionaire interests. He acknowledges their potential therapeutic benefits for conditions like PTSD, depression, and even problem-solving. However, he also highlights the risks of misuse, overenthusiasm, and the influence of evangelism that can cloud objective evaluation. The conversation raises awareness of psychedelic compounds' diverse physiological effects and the need for responsible science-based integration into medicine. Throughout the episode, Buhler emphasizes that transformative health outcomes begin with individual empowerment, education, and accountability. No medication or technology replaces personal commitment to diet, movement, rest, and mental well-being. He urges listeners to take small, deliberate steps and avoid dependence on pills alone. The goal is sustainable health span improvement through a comprehensive, integrative approach supported by cutting-edge diagnostics and therapeutics, beyond what the traditional healthcare system typically offers. Brigham Buhler invites listeners to explore his company, Ways to Well, which embodies this new healthcare philosophy. With integrated diagnostics, AI-powered decision support tools, telemedicine, compounding pharmacies, and personalized treatment plans, the practice offers patients a chance to reclaim their health sovereignty outside of insurance constraints. The approach centers on detailed biomarker analysis, hormone optimization, and regenerative therapies, focusing on prevention and root cause resolution. Buhler underscores the importance of accessible, affordable care grounded in science and patient choice.